In some ways, it feels much like it did before. Now, with almost 100,000 more people every day being infected with COVID-19 in England alone, with more places facing more restrictions and more hardship. Some hospitals are cancelling operations. This time, though, no one's doing this. The rainbows have faded. On Thursday nights, we're not out clapping on doorsteps. And the biggest difference, we're not in full lockdown.
We'll obviously keep everything under review, but we don't think that now is the right time for a blanket national lockdown, because although that can be a simpler and clear message, it also wreaks a great deal of harm to people's livelihoods and broader health and well-being.
Another figure today serves as a stark warning. For every 40 people in Yorkshire and the Humber, one has COVID-19. Imperial College London's latest infection report, based on tens of thousands of swab tests in England, shows cases still highest in the north, but things changing fast everywhere. Overall in England, cases doubling every 9 days, and the R number, now on average around 1.6, but in much of the south above 2. In London, it could be as high as 2.86, meaning an infected person, on average, infecting almost another 3 people.
Ultimately, it's really simple. We just all need to reduce our contact with other people.
It's back to basics, in part because the national test and trace system still isn't working as it should. In this part of West Yorkshire, the Director of Public Health has got her own team of contact tracers, picking up the cases that are being missed. But she says she can see gaps and warns some are struggling to access the self-isolation grant.
At the moment, obviously, we're not reaching enough of those contacts and we're not able to give them the advice and support that they may need. We are working really closely with the government on this at the moment in West Yorkshire. We've identified these issues so that we can ensure that people that will be financially really affected by self-isolating are able to get some financial support.
We are, as of now, making progress in Scotland, but cases are still rising.
With Scotland's new tier system starting on Monday, for now, no areas will go into the highest level with full lockdown-like restrictions.
That could happen if, for example, cases in part of the country start to rise faster again, to the extent that controlling spread with travel restrictions will not be effective. Or it could happen if pressure on the NHS risks breaching capacity, not just at a local level, but overall. We want to avoid this, obviously, but to achieve that, we must all play our part.
Despite calls to go further in England, it is still tiers and local restrictions. Oxford and Hull next to go to Tier 2. West Yorkshire goes to Tier 3. Meaning soon there'll be no mixing or mingling, even in outside beer gardens. Different rules in different places means for some, things are harder than for others. But this weekend, a new indoor venue opens in Manchester in Tier 3.
Tier 3, where the rule is you can only socialise with people in your house. That's been really hard. Most people do socialise with people outside the house.
Build back better, not locking down everywhere. Still, for now, the strategy.
Pizza Express says it plans to cut around 1,300 jobs and close 73 restaurants because of the impact of coronavirus restrictions. The chain, which has 370 outlets across the United Kingdom, said reduced seating, local lockdowns and the 10 p.m. curfew had all affected customer numbers. City centre sites were worst hit, it said, but the job losses will be spread across the businesses. Well, joining us now from West London is Paul Elliott, Director of the REACT study and Chair in Epidemiology and Public Health Medicine at Imperial College London. Thank you very much for joining us, Professor Elliott. And it's your research which says the R number is now 1.6, and I think you're indicating 100,000 cases, new cases, every day. Now, what does that therefore tell us is actually happening?
Well, that's correct, John. And the way the study is conducted is that we write to random samples of the population in England and invite them to take part in our study. And if they agree to do so, we send them a swab kit so that they can do their own swab of the throat and the nose, which then gets sent to the laboratory to test for the virus. So we get a very, very comprehensive view of how the virus is spreading across the country. And in particular, it's not reliant on people presenting with symptoms for testing. So it's outside the testing system. And that means that we pick up not only people with symptoms, but people who don't have symptoms either on the day of the test or in the previous week. And that's around 50% of the population. So 50% of people that test positive in our study don't know they've got the virus and potentially can be passing the virus on.
Could I just butt in there and just ask you, I mean, my maths isn't the greatest, but if you look at 100,000 today, then by my calculation, in 8 weeks, we'd be talking about 1 million.
Well, with the doubling rate as it is, that you mentioned, as you say, unfortunately, the doubling rate has gone down and the R value's gone up, so the doubling rate's gone down. Unless something happens and that the R rate gets turned down and the virus gets brought up more under control, unfortunately, you're right, the doubling rate means that the numbers of people testing positive will double every 9 days. So clearly we have to do something as a community in order to control the virus.
What is that something, Professor? What is that something?
Yeah, so I think it's a combination. So first of all, you know, the social distancing we know is the key, because the way this virus transmits is through social contact. So it behoves us all to pay attention to social distancing, wearing face covers and washing our hands as required. And even, you know, if we all do a little bit, that could have quite a big effect at the population level, which is what we're measuring. Then, of course, you're talking about these new measures that are being brought in now. Clearly, the very recent measures haven't fed through into our data.
But
and we need to keep
are you also arguing for a total lockdown?
It's what we need is there are two things going on here, John. One is the increase in the virus, and in the north we have very high levels, and that's already impacting on hospitalizations and deaths, as you said earlier. And then in the south we're seeing really rapid rises, but from lower levels. And it may be that we can have a regional type approach, or we need a national approach. But really, it's around individuals complying with what we need to do, which is reduce social interactions and keep to social distancing. And how that's best achieved clearly is for policymakers to decide.
Well, Professor Elliott, thank you very much. It's very clear. It's comply, comply, comply. Thank you very much indeed for joining us.